When discussing men's health, the prostate gland stands out as both crucial and oft overlooked. Prostate cancer, one of the most prevalent malignancies among men, remains a significant health concern. Yet there is considerable ambiguity surrounding the optimal method for detecting the disease. Prostate screening is a key approach to diagnosing cancer in its early stages, and it has become a subject of debate among both physicians and patients. However, the precise timing for initiating this process remains a point of contention. It is crucial to understand that prostate cancer is not a monolithic disease. While it is common, many men diagnosed with prostate cancer do not experience aggressive disease progression. Certain types of prostate cancer grow so slowly that individuals may live for years without the disease causing substantial issues. This raises the question, when is screening warranted? The answer is not straightforward, but let us delve into the key factors to cultivate a deeper understanding. Prostate screening can be conducted through various methods, but the most prevalent are the PSA test, which measures the level of prostate-specific antigen, PSA, in the blood, and the rectal examination, where the physician palpates the gland via the anal canal. While these examinations can identify early signs of cancer, they are not without limitations. The PSA test, for instance, can exhibit elevated levels due to factors other than cancer, potentially resulting in false positives and subsequent unnecessary examinations and treatments. It is crucial that prostate screening is not perceived as mandatory at all ages. To determine the optimal time to begin the process, it is important to consider family history, risk factors, and, of course, individual health status. A pivotal factor influencing the recommendation for the initiation of screening is age. Men with a family history of prostate cancer or possessing other risk factors may require an earlier start to screening. Individuals without these factors, however, may not necessitate screening until a later age. Discussing the optimal age to initiate prostate screening requires an understanding not only of the disease itself, but also of its individual impact on each person. For example, at age 40, a man generally wouldn't have an immediate concern about prostate cancer, especially if he lacks a family history or other risk factors. However, as age progresses, the likelihood of developing prostate issues increases. This doesn't imply that every man will develop cancer, but rather that the need for vigilance becomes more pertinent as the years advance. Studies indicate that for men aged 45 or older, it is crucial to initiate a discussion regarding prostate cancer screening with their physician. For individuals with an elevated risk profile, screening may be advisable at an earlier age, such as 40, contingent upon individual circumstances and medical guidance. While prostate cancer tends to predominantly affect men over the age of 50, as previously noted, this can fluctuate based on family history and other contributing factors. Here's a crucial reflection. How many of you have taken the time to discuss this topic with a medical professional, or even know which tests are appropriate for your individual profile? If you have a family member diagnosed with prostate cancer, it's imperative to seek medical guidance on when to initiate screenings. The key takeaway is that early detection can be paramount for effective treatment, should it be required, regardless of your age. And here, I extend an invitation to you. If you haven't already subscribed, take advantage of this opportunity to subscribe to the channel. We'll delve deeper into this topic in the upcoming segments, but your involvement is crucial. So, for those who have been following along, please share your experience or your perspective on the subject. Have you ever considered prostate tracking? Let me know your thoughts in the comments. I'm genuinely curious to hear your insights. The method by which prostate tracking is conducted encompasses several pivotal examinations, and comprehending their functionality is crucial for making well-informed decisions. The PSA test is a straightforward and expeditious procedure that quantifies the concentration of prostate-specific antigen, PSA, in the bloodstream, a protein synthesized by the prostate gland. However, elevated PSA levels do not invariably indicate the presence of malignancy. An elevated PSA level can be attributable to a multitude of benign conditions, such as benign prostatic hyperplasia, BPH, and even urinary tract infections. Another common examination is the rectal exam, which, although often avoided due to discomfort, enables the physician to assess for any irregularities in the prostate. The combination of these two examinations can provide a more comprehensive evaluation. However, in many cases, early diagnosis of prostate cancer does not lead to a significant improvement in patient survival. The reason for this lies in the nature of the disease. Many types of prostate cancer grow slowly and do not pose an immediate health risk. This is a crucial point, as early detection, while potentially life-saving, may also lead to overtreatment, which can have unintended adverse effects. For instance, Treatments such as prostatectomy or radiotherapy can result in complications like urinary incontinence or sexual dysfunction. Consequently, many physicians advocate for a more judicious approach, engaging in a thorough discussion with each patient to ascertain if the benefits of screening outweigh the risks of unnecessary interventions. A fundamental distinction we must grasp is the difference between screening and diagnosis. Screening involves searching for early signs of cancer before an individual experiences symptoms. It is a proactive and systematic approach. Conversely, diagnosis is initiated when examinations reveal abnormalities, typically when the patient presents with symptoms or when screening uncovers worrisome findings. However, the paramount concern here is the accuracy of the examinations. Screening, particularly using PSA and rectal examination, can lead to a cascade of additional tests, many of which may prove superfluous. This is because, as we have discussed, not all identified prostate cancers are aggressive. For older men with indolent prostate cancer, treatment may pose a greater risk than simply monitoring the disease's progression. In light of this, it is crucial that the decision regarding prostate tracking be made in collaboration with a physician, taking into account both the potential benefits and risks. The physician may recommend alternative surveillance strategies, such as active surveillance, wherein the patient is closely monitored with regular examinations, but without the requirement for immediate treatment. This can be a viable option for men diagnosed with non-aggressive prostate cancer who are asymptomatic. Technology and medicine are continuously progressing, revolutionizing the way prostate tracking is conducted. Novel diagnostic tools are being developed to facilitate the early detection of prostate cancer, offering increased accuracy and minimizing the risk of false positives. Furthermore, personalized medicine, which takes into account a patient's medical history and genetic profile, holds the potential to significantly advance both the monitoring and treatment of this disease. However, for now, the decision to undergo prostate cancer screening remains a personal one, based on factors such as age, family history, and overall health. The most crucial aspect is that men remain informed about when to seek medical guidance and stay abreast of advancements in the field. Now, before we wrap up, I want to hear from you. What did you think of this video? Did anything change your perspective on prostate tracking? Please leave a comment and, more importantly, share your story with us. Your experience could help others facing the same dilemma. And if you haven't subscribed yet, take a moment to do so now so you don't miss out on more content like this. We're in this health journey together, and your participation is crucial for enabling more people to learn and take care of themselves.